Ladies and gentlemen, good afternoon, and thank you for joining us here at the Ministry of Information, where this afternoon we bring you our second brief for this week. I think on Sunday, our first brief had to do with the energy sector and the kind of updates on the upgrade works ongoing there. This afternoon, we are joined by our regular suspects, our good friends from the Ghana Health Service, who we've been with for a little over a year now, battling COVID. You recall a few months ago, talk intensified of the vaccine rollout program, and the first dose of the AstraZeneca vaccine, known as Covishield, for Ghana was rolled out. On Sunday, His Excellency the President addressed the Republic and mentioned that from this week, some more detail ahead of the second dose will be made available. This afternoon, we're happy to have with us our friends from the Ghana Health Service, Dr. Aboagye Da Costa, Dr. Esiedu Bekwin, Dr. Achianu, who is in charge of the expanded vaccination program at the Ghana Health Service. And then my good friend and brother, Dr. Patrick Umabwaji, who will deliver the brief. Doc, haven't seen you in a while, but welcome.
Objective for this, but whilst we are here, we'll give you a short update of where we are as far as the COVID is concerned, both at the airport, in our schools, and the general population, and of course end up with a COVID vaccination update. I hope that whatever I have not covered will be asked in the questions during the... I think you are showing the wrong file. Okay. So as of May 15th, 2020, we have had a total of 93,456 cases. And we have so far as a country conducted about 1,130,000 tests, bringing our cumulative positivity rate to about 8.3%. We have so far discharged about 91,384. That's about 97.7% of all those who have ever been positive. 771 deaths, and currently our active cases is about 1,325, a slight drop from the 1,500. And I must say that we are not going to see very significant drop in our active cases because we are in a state where the numbers of discharge and new cases are usually sometimes quite close, because we are all in a very low cases report today. So far, all 16 regions have reported cases. So if you look at the charts, these are the usual charts we show. You can see that the active cases are more in Accra compared to about 900 or so are currently in Accra. The rest are in the rest of the country. And then, of course, the second graph shows the cumulative cases, which shows that the deeper your color, the more number of total cases ever reported in Ghana. As we are all aware, we've had about 2 major waves. We've just come out of the second wave, and now you can see that the numbers in the toward the end of the graph has remained stable and slow. The same shows in terms of the 7-day moving average, which gives you an indication of the average number of cases that your country is reporting, because it cannot be very uniform. When you do a 7-day average, you get a more uniform approach to the number of cases you are getting. You can see that we are currently at very low level, just like we were in October, September last year. The next slide also shows the active cases. We peaked so high in the second wave, almost over 8,000 active cases, but currently we are doing quite low. We've been stable around 1,000, 2,005 in the last 4 or so weeks. So far at the airport, I think the last 2 weeks we had our own a lot of discussions centered around the airport testing. We so far recorded about 1,732 cases at the airport since it was opened in September 2020. The majority of them are non-Ghanaians, about 1,000 of them, 58% of the people who have tested positive at the airport are non-Ghanaians. Males dominate, is about 63%, and females 36%. The center has so far tested about 269,144 with a cumulative positivity of 0.64%. You can see that April we had very high numbers. Remember the 75 and the 38 and the 41. As at May, so far, middle of May, we have done about 87 positive cases. And we always do all the variants for them to see what type of variants are coming into the country to help our preparation. For the schools, since they were reopened, so far we have an active case of 15. Only 15 children currently are known to be positive. But we are so far out of all the schools in the country that were reopened, 348 have recorded a case. We have so far recorded over 2,000 cases, 2,076 cases in our schools. And like I said, only 15 are currently active. 99.2% of them have recovered. But it varies. 2 weeks ago, the active number of active cases was 2. But then you have a few small outbreaks in the school, and the active cases will go down. And we hope that to continue going down. Northeast is one region that has not recorded any case at all. So the outlook for us, that we are recording lower cases. We have some sporadic surges at the K.I.A International Airport, and that is to show that it's responding to the external pressure. Once you have surges in other countries who come into the country, you also see that the numbers go up. Just like we had the Indian surge, and you saw the numbers also go up at the airport, showing that it's really responding to what it was set up to do. We all need to continue to adhere to all safety protocols, including the mask use, to continue to be able to maintain the status that we are in and ensure that we don't move into a phase like the January, February one, which nobody really wants to ever revisit. Now we can come to I'm sure most of you are eager to look at the vaccination and the rollout of the second phase. Just as a recap, I'm sure you remember that on the 24th of February, we received the 600,000 doses of AstraZeneca vaccine. We have since received an additional 386,850 doses. And we started deployment from the 1st of March 2021. And this is still part of the comprehensive plan to vaccinate the 20 million persons in phases starting with the at-risk most. And so that plan still remains, and we're still confident that we'll be able to deliver on that plan. The deployment, as we've described to you, have been based on both population and geographical segmentation. The population segmentation is about who are at risk. How do we segment the at-risk people? How do we segment people who are essential service workers? And the geographical location is where do we have the largest number of cases? And so that will influence your approach. For example, if you were to focus on some of the large areas where we have more of the cases, obviously it is a lot easier to be able to bring the pandemic under control than just spreading everywhere. The deployment has been based on, we have the 1A, which we have gone through, as the 43 hotspots where we have recorded the largest number of cases, as you can see from the chart I showed you. 1B has been the health workers in all regions, in all districts, and so far we've done about 80% of all health workers in the country has been vaccinated, wherever, irrespective of geographical location. Phase 3 will be, 1C is the mixed target. Now, so what is the persons at most risk? The healthcare workers, which have been covered, frontline security staff, persons with known underlying medical conditions, those 60 Plus, you saw that they are more likely to fall ill and also succumb to the condition. Frontline members of the executive, legislature, and judiciary, the state must continue to run. Teachers above 50 years of age and other essential service workers as defined, like the power sector, etc., and some critical media persons who had to be also covered. So group 2 also, that was group 1. Group 2 is the other essential service provider, including the rest of the security agencies. So talk about water supply, electricity, teachers, students, etc. These are all very essential groups that must be protected. SEPs, among others. We also have the group 3 will be the rest of the general population, which eventually will get there. And then all persons 18 and over, excluding pregnant women. And the group 4, which we are yet to get, there is all others. When approved, that is pregnant women, lactating mothers, and children under the age of 18. Should we get a vaccine for it? But as you are aware, one of the vaccines, Pfizer, through experiment, had been able to demonstrate that children between 12 and 15 can be given. They were doing 16 and above, and so which means that Pfizer is from 12 to upwards. But as studies goes on, we will see whether the other vaccines will be able to be given to children, and look at that. So now, just trying to make a case for where we are. Geographical segmentation for the initial 600,000 doses. You saw we had Greater Accra Metro, and 25 other districts were selected because they showed the highest number of cases. There were 2 districts in Central Region that also presented a lot of cases, Kaswa and around the area. In Greater Accra, Kumasi Metro, Obuasi, East and West, and 19 districts in Ashanti. These were regional districts that showed significant number of cases that was becoming a problem. As you can see, the cases are nurtured in a certain area and they spread, and so the geographical location is extremely important. The next chart just shows you the names of the districts for those who want to know. So far, we have on our database, synchronized database, 852,047 people who are so far being vaccinated. And you can see Ashanti and Greater Accra has recorded the highest number in response to the geographical location that we were looking at, and the rest of the country have also received them. The largest group of people who have had vaccination is about the health workers, which I said is over 80%. We've had the security about 49.6%. The executive and judiciary about 25% of them. The aged, 70.9% of them, and so on. So that's how the segmentation has gone. Now, the second dose. We have received an additional 350,000 doses of the AstraZeneca vaccine, which arrived in the country on the 7th of May 2020. Persons who received the first dose from the 1st to the 9th of March are due for the second dose. And this number approximately comes about 360,000 persons, just for what the current vaccine can cover. That is in the initial 43 districts of Greater Accra, Ashanti, and Central regions. That is those who will receive their first dose. We will start on the 19th, which is tomorrow. But so far, we have had refresher training. As part of our preparation, we have had to do a refresher training on the representatives of the 43 districts who completed the 12 on the May of 2029. And this is mainly we had a lot of work on the database, because the data is extremely important, because that was how we need to now show that we have changed the cards, and so our data requirements also need to be more accurate. We have to work on the logistics, and all vaccines have been distributed to the sites where vaccination will take place. The target communication for sensitization for where you can have your vaccine, side effects, among others, and all the concerns that we are following up either from our AEFI or on some of the communication that we hear from the community. We are doing that, and also community engagement continue to go on. We have trained our national monitors and will be deployed. We are being deployed today. We are in preparation for tomorrow's start of the vaccination in all the 43 districts. And as has already been mentioned by the President, vaccination starts tomorrow morning. Those in the first, those who had their first dose from the 1st to the 9th March will be the one that will be covered. And we are hoping that by 26th of May we'll finish, but it's really not a definite. We'll just go on until all the 360 are vaccinated. And if we are able to get more vaccines immediately, we will continue. So the designated facilities will also be communicated by SMS. I'm sure some of you may have received their SMS already that you are due for vaccination, and it is coming in phases. I'm sure by the end of the day, most people would have received their message as to where to go, and the fact that they have been identified as a group to receive vaccines. We have also made a revision on our cards. When you go to the site, first you have to go to, we are advocating that you go to where you receive your first dose. Go there with your card. Your card will be reviewed to look at the date you will receive your vaccination, and then it will be replaced. It will be replaced because we have had some change, more enhanced features for the card that we will receive. Then if you look on the right, there's, please let's go back. There is the QR code. Anytime you enter, there's a number that is written at the back of your card. That's what is generated as ID number for you, unique ID number for you. Once it's there and you take your smartphone to scan, it will ask you for your ID number. Once you enter, your total, all your information will appear on the phone. And this is so that whether you're at the airport or so, and anybody wants to validate that you are really being vaccinated, your name, as we can write, and so you're able to pull out your results immediately. And you can also check for yourself to see if you want further information on that. When you go and you feel that there are any errors in the initial entry, it's an opportunity for them to also correct that for you. Already we have people are carrying, in other parts of the world, carrying fake vaccination cards, that they are fully vaccinated when they are not. And so as soon as you receive your second dose, a hologram will be pasted on the card that we're going to give to you. That shows that you are fully vaccinated. And so that's where you see the hologram down there. That is not in the first one. And so these are the new features that has been put to you. So to recap, once you go there, go to where you are, as much as possible, go to where you had a first dose. They will pull your data out, make sure you are due for vaccination. You'll be vaccinated, your card will be replaced, and then all the necessary information will be given to you. We have also put out an infographic for all the locations. It is available to the Ministry of Information. They can share with the media so that you know where the centers are in Accra, centers that are in Accra, all the centers in all the 26 districts in Accra and Ashanti region. You can also see that they are all there, all the 43 districts. The centers are identified, and so you can also inform people that where they can go and have their vaccination done. Honorable Minister, thank you very much.
Doc, thank you. We would move straight to take questions. My first being, what if I can't find my old vaccination card?
Can I answer?
No, wait, I want to take a few more before I come to you. Colleagues, that was just a fair shot, but the microphone is available. You just give us a wave, we'll send the microphone to you and you can ask your question. Yes, madam. Please identify yourself.
My name is Sakosia Ochi. I work with City FM and City TV. So I'd want to ask, what new plans are we putting in place to ensure that these centers that we are going to have the vaccination exercise take place will not be, first of all, crowded, and two, will not waste a lot of people's time? I'm talking in respect to the previous vaccination that we did. For the press center, at a point, we had just 2 people collecting the data, and there was an issue with how they were collecting it. They were using the tablets, which was a bit slow for the whole process. And so I want to ask, what new plans have we put in place to ensure that we are not going to waste a lot of time at these centers? Are there going to be more people recruited into the team, or more technology to be used? That's my question.
Thank you. Yes, sir. So 1, 2, is there a fourth? So that I just do a batch and then I come.
Justice,
yes, sir.
I'm on the Daily Graphic. I want to know whether taking the second jab gives you total protection to the extent that you wouldn't have to wear your nose mask again. Thank you.
There were 2 at the back, yeah.
I'm Seth, Kingdom FM. Me pese mi hu se obi wono ma vaccine no Accra but bibinti wako different region no obetimi the card no akonya second dose no different vaccination center na.
And just next to you.
Please, my name is Richard Atabo. I'm from Accra FM. Do you have plans for those who didn't take part in the first jab? That's my question.
Okay. So, Doc, we'll take responses.
Yeah, thank you very much. With the crowding, yes, and that's why we are sending text messages, and we have also told people who qualify, those who had their first vaccine between the 1st and the 9th. And we'll continue sending text messages as to where you can go and when you can get. That is a way of trying to reduce crowding and people not going, so that we told when to go, and I think that will help reduce crowding. We are also hoping that the media will also assist with the information so that people will not rush to these centers. Now, you talk about waste of time. I don't think going for vaccination is a waste of time. But be that as may, what we have done is that at that time, a lot of information, data had to be taken. This is the very first time we are doing vaccination that requires so much data to be taken. And of course, in any system, once you start using tablets, over time you get faster, like you saw towards the end, or when we were going to the last 315. People have been used to the system and they were able to look at that. Of course, they started with a few teething problems with synchronization. That has all been done. So, but fortunately, for this one, you only pull out your database, which already entered, and then they enter your second dose. That's all. So really, the data requirement is not going to be as high as if you are going for your first dose. The second jab, well, it may give you protection, but doesn't protect everybody. Let me explain to you. For example, the one with the highest efficacy vaccine is about 94%, which means that 6% of those who have had that vaccine can still be infected. I mean, the probability that they can be infected. Now, you have 3 benefits. Being infected, you are protected from being infected, but it's not 100%. Hospitalization, getting sick and being admitted, you are protected, some of them as high as 80 to 90%. And then the third event is death from the vaccine. Now, as long as not enough people are vaccinated, the 6% of the people who are vaccinated who may have the virus may transmit to somebody who is not vaccinated, and so as still a significant number of population are vaccinated, so that the chance of you multiplying the virus within you and you transmitting to somebody who is vulnerable is there. You all have to continue wearing masks, even if you are fully vaccinated. I think the same thing goes for the question about whether your second jab, does it mean that if you have, okay, now, If you for some reason you can't go to your location, just make sure you have your card. As long as they have your unique ID card on your card, once they enter, they will pull out your data, and then they can be able to answer. We'll question, answer, and then say, so we'll call baby fufra if you have to go, but so we'll call baby fufra because if you want to be a bank, I want to call back. We'll call you card. Now they call, number no, information at any center. But say ain't created too much crisscrossing, as much as possible. No, be anchor, baby, born. The last question, Accra FM. I think I didn't get a full question properly. Those who did not take their first job or who have not yet taken their first job, yes. Do they qualify under what is going to happen from tomorrow? Not for now. We are currently trying to secure those who have had their first dose. But a lot of effort is going on to bring in additional vaccines to start the first dose. Because the ultimate aim for the 20 million is still exists, and that's what we are working on. So as soon as vaccines come, they will also be given. The president talked about the Sputnik. That will be a different cohort of people who receive vaccines from the Sputnik. And I think there are many other approaches that are coming, and hopefully it's not coming the way we wanted it in bulk. But at least as they come in, we will continue vaccinating and protecting everybody. As I prepare to take the second batch, my question stands: what if I've lost my card? I can't find my card, but I believe I took a shot the first time, and I believe I qualify now, so I've come. Because I'm sure you get a lot of incidents. Oh, yeah. I think people are doing, even the people who leave it at home. But that would be a difficult mind, but once you're able to give a name, and especially if you went to the same place, they should be able to, if you give them a few variables, they should be able to pull out your data. Go with your ID card. Any ID card will give them the number, because they use ID card to enter, and they can still pull out your data and vaccinate you. Very well. Colleagues, I'll come for the second batch of questions, but something strikes me that the policy decision that will be made as to when all of us can stop wearing masks will not be dependent on whether or not an individual has had both doses. It's on whether or not a significant proportion of the population has had both doses. That is when that policy decision can be made. I'm correct? Yes. Okay. So that people don't say, me, I've had 2 shots, so I can go around without masks. Colleagues, do you have any questions? I'm happy to take them now. Yes? The Finder newspaper.
Salam Bobiji, the Finder. If I realize that a center is empty, right, so in the course of the job taken, a center is empty, and I didn't take my shot during the first round, can I walk there and say, well, you are not doing anything, I want to take a shot?
Yes, sir. Are there any others so that we're clear on the mapping?
So Kingsley from the custodian.
I'll come here, and then I'll come to you. Yes, sir.
Kingsley from the custodian. Dr. Waji, are we not going to experience shortages at the center of the vaccines? Because if you allow people to go to where they didn't take the vaccines for the first time, and now we are saying they should go, are we not going to experience shortages of the vaccines? Thank you.
I didn't quite get that. Are we not going to experience shortages? Okay. Doc will deal with that. Yes, sir.
Yes, sir. Madugo Viniza at Nka TV. For the
you can actually sit down and then ask your question.
Thank
bring
you,
the microphone to you.
When the president and then the VIP took their first jab on cam to boost public confidence and then trust for the first exercise. Aren't they supposed to take theirs today, and why are we undermining that exercise? Sorry to put it that way. Yeah. And then also, the first people, the first exercise, you gave us 360,000 people, and then the vaccine we've had is 350,000. The minus, when should we expect those numbers? Thank you.
So when should we expect the next extra doses to come in? I think on the question of the president and the vice president, I'll check and give you information whether they will do it publicly or not. Yes, sir.
Doc, are we to expect a recurrence of the adverse effects we experienced with the first jab? Yeah.
Or is it the fact that once you got adverse effects the first time, you are also immune from adverse effects? Yes, sir.
Yeah. Good afternoon, Dr. Boji. We are experiencing a downward trend of the disease. Is it because of the jabbing, or is it because of a behavioral change of the Ghanaian populace, or the disease itself is coming down in Africa?
But I think it's a very important question. Can we ascribe the downward trend to the vaccination so far of about 800,000 people in the hotspot areas, or do we think it's because of some other factors? Doc, we're in your hands.
Yeah, thank you very much. The center is empty. This stage is for those who are going for their second dose. It's not for first dose. So you cannot walk in, but there's nothing happening here, so give my first dose. And that goes to answer the question, is that the fact that you crisscross doesn't mean that the vaccine will. We have a cohort of people, 360,000 that we are going to vaccinate available. Wherever you go, it's the same vaccine. It may, if you have an resurgence into one place, you may have some logistics movement, but you only have to move vaccine from one end to another if there's a good reason why people want to go to a particular place. So that shouldn't really be a problem. The question was it a 10,000 difference you are asking for? Yes, you don't normally run totally out of vaccines. You always have a strategic stock. And that's the stock, some of the stock that's been added to sort of boost the number from 350 to 360. It may even be slightly more. You have, if for example, people are traveling and they need to be vaccinated, so as a country, there's a small strategic stock that can be used for others, and that's why we are able to look at that. But there are plans to get more vaccines for people's first dose, as I mentioned earlier. Adverse effects, yes. Yes, you should expect. It's going to initiate, it's going to sort of come up with the same effect. You're going to get boost of immunity, and so you are likely to also have some side effects. That people didn't have any side effects. They may have it this time, or they may not have at all. So you are not going to expect anything different from what we saw in the first jam. And the decline in cases. Normally, the vaccine will take about 3 weeks to become effective in terms of reducing spread. AstraZeneca gives about 76% protection. So after 1 million, about 800,000 people vaccinated in a place where there's a critical mass of people where the cases are, it definitely is contributing to the reduction in cases, but also adherence to the protocols. The fact that we're able to celebrate Easter quietly, and the fact that Ramadan, the Eid was also, we're able to, they are all contributing to the fact that we have been able to remain stable. As long as you reduce interaction, people are not, workplaces are applying the protocols, schools are applying protocols we should expect. So they are all contributing, but obviously the vaccine is also playing a role.
Abednego, I thought I saw your hand up. Abednego, step forward, but there's a lady. Well, you know we're biased towards ladies, so let's start with the lady. Doc, there's a question I see on our platform here. It's asking, I mean, if I just may paraphrase, he knows that he took it between the 1st and the 9th, but he hasn't received a text message yet, so should he wait to receive a text message before he goes, or he can still go, even without the text? So please hold on to that one. Yes, madam.
Thank you. Dr. Kumar-Boakye, please, I'd like to know, you've already made us know that government is making efforts to get additional vaccines apart from the 350 that were received. Can you be certain as to what arrangements have been done to give some form of certainty to the remaining 500,000 Ghanaians who are also expecting to get the second dose? What systems or measures has government put in place to receive extra AstraZeneca vaccines for the remaining 500,000? And when is the Sputnik coming to Ghana that has already been approved by the FDA?
Sputnik is in Ghana, right?
Yeah, we have some.
So when are you going to start the vaccination with Sputnik? So you will add that to that one and then you can answer. Abednego.
Your friend Abednego Asante, me at Mawadom FM. My question I'm person is during the first phase, in your report say vaccines now what they call some regions expire and Montiman use. Until this time around, the emergency and I say and she said go up and say one for be brain called Babia quote unquote moon here. I because expire meanwhile other regions say be or mope via or her shortage MR system. Thank you.
Is there any other question? Doc, a final question that I'll add to it. How long do I have to wait to take the vaccine if I recently recovered from COVID? Is there like a lead time after recovery before you can take the vaccine? Thank you.
Yeah, thank you very much. Honorable. The extra vaccine, yes, a lot of effort. One of the first things is the fact that the COVAX facility still exists and they continue to bring in vaccines. What we have done as a country is also get ourselves very, very ready with very efficient delivery system. And I think we have been classified as one of the best in terms of deployment of vaccines. And so as the vaccine sharing protocol goes on, where vaccines are not able to be used, always Ghana will also be considered to be giving vaccines, because if, for example, the USA has vaccines to give out, and they have probably a month or two to expire, they'll give it to a system, a country that is able to deliver, so that doesn't really get expired. That's one of them. There have been also a lot of bilateral arrangement. The COVAX facility still exists, that they will continue to give us vaccines, and that will definitely come. It will move from 20% to 30%, and we are hoping that one will come. There are also arrangements with Sputnik to get vaccines, and other, the private sector foundations are also involved in trying to mobilize vaccines into the country. And I think these are all the current assistance that we are doing. Government to government engagements are going for. But I can't give you a definite date at when the Sputnik is coming, but I know that the 300,000 should be coming very soon. And like I told our friend, this thing is not coming by ship. Well, I heard some bill of lading. But if they fly tomorrow, by the following evening, it's here. So as soon as we get wind, just like we now the other, we'll also let everybody know how we can have them. Do you have Sputnik in the system, right? Yes, we have. Yeah, we have about 16,000. But we will look at a small cohort to give to. And so we are expecting a larger dose that will come in soon. How do we prevent expiry, right? The last time the expiry was 580 doses. That was what expired. That was, we had 10 days to deliver 315,000 vaccines, doses. And so based on our system now, I'm sure this 358,000, even though we are looking at scheduling to 26, I can assure you by the 21st or so, if people come, it will be done. Because this is going to be an easier vaccination than doing the very first one, where you need to take a very comprehensive database to give them. So I don't think we're going to have any challenge with expiring. The current dose expiring on the 24th of June, and that gives a long time for us to finish the vaccination. How long do you want to wait if you have had, you have just recovered? Well, you can, once you don't have it, you can always have it. But if there are two of you and I'm not had it and you have had it and it's only one, we'd rather give it to the person who has not had it and then give the person who has recovered some time, because they may have some antibodies to protect themselves. But we don't have any definite time that we have to wait, because the science is not too clear. We have situations where people have had it, but they didn't produce antibodies. And so we don't want to really take those chances.
Okay. Many thanks for your time, to yourself and to your colleagues for giving us that update. I'm sure our colleagues in the media would follow how the second dose rollout starts tomorrow at the various rollout points. And we'll share with you when we get information on whether or not there will be a public taking by some key persons, as was done in the first instance. Doc, thank you very much.
Yeah, I just want to add that the infographics are available so that they can show people which centers to go to.
So we'll put it on the press pool platform so that you can share it with your various audiences. As we say thank you, tomorrow morning at 10 o'clock, we would invite you for another briefing. The phase 3 of Operation Halt 2 has ended, and there are some updates that the Ministers for Defense and Lands will join us to share. So 10 o'clock tomorrow morning, we'll see you. Thank you so much.
Thank you very much, Honorable Minister.